People on the phone, you can mute and unmute by pressing *6. For folks on the phone, you can mute and unmute by pressing *6.
Hey, everyone in the pool, we don't see him out in the hallway yet, so we'll let you know.
Final reminder for folks on the phone, you can mute and unmute your phone by pressing *6. *0300, you can mute your phone by pressing *6.
Hey, everybody out there, the governor's not here yet, so you're not missing anything.
Yeah, everybody's, even the copy desk is at home. It's pretty impressive that they're putting together a paper with that actually copy. Although I can say, communication when you're all in the same room is pretty lousy, so they may be doing better. I don't know. And a lot of the reporters have been working from home when we renovated the offices back a couple of years ago. So most of us have done it. It's pretty easy. When I did it
Okay, everyone should be in here in 30 seconds. Maybe.
Where would you like me? I'm gonna borrow a chair too. I'll borrow a chair.
Just to your right, Governor.
Thank you.
Good afternoon, everyone. My name is Dr. Nirav Shah, and I am the director of the Maine Center for Disease Control. Thank you all for joining, and thank you to Governor Mills for being here as well today. I'd like to start by providing an update on the COVID-19 situation across the state. As of right now, the Maine Center for Disease Control is reporting 118 cases of COVID-19 statewide. This reflects an increase of several cases overnight. As of right now, there are 15 of those cases who are hospitalized. 7 cases that we have previously recorded are fully recovered and have been released from isolation. We now, statewide, are reporting cases in 10 counties. The latest numbers include a new county, Waldo County, among the cases that we've seen statewide. Overall, Maine CDC has received 3,185 requests for consultation from healthcare providers across the state. I'd like to just pause there for a quick moment and note that the cases that we detect in any outbreak setting, whether that's COVID-19 or any other type of infectious disease situation, merely represent the tip of the iceberg. There have been questions about whether and to what extent individuals should start taking action. And given that what we are detecting in any outbreak is only the tip of the iceberg, now is the time to start taking public health action. To put that differently, even if you live in a county that has not yet recorded cases, there is no need to wait until your county is on the board before taking preventive public health action. The absence of evidence of cases in your county is not evidence of absence of cases in your county. I'd also like to provide an update on testing across the state. There are now 3 additional commercial entities that are providing testing services for COVID-19 to Maine residents. In addition to Quest and LabCorp, which have already been online, there are now 3 additional corporations or entities. One is the Mayo. Second is an organization or a commercial laboratory called ARUP. And the third is an organization called BioReference Laboratories. So there are now a total of 5 commercial entities that are offering testing across the state. This is in addition to the testing that is offered by the Maine CDC's laboratory here in Augusta,
as well as a laboratory affiliated with Maine Health called Nordex. I'd also like to take a moment to discuss the backlog of tests, the topic that we discussed yesterday. As of right now, there are roughly 1,300 tests awaiting running at our laboratory. Let me just say right up at the top, that number is unacceptable to us, and we acknowledge that. The number is a function of two interrelated factors, the chief of which is a national shortage in one of the chemicals that is used to make the reaction that is used to test for COVID-19 happen, a so-called reagent. And there is a national shortage of this reagent that has affected laboratories, especially state public health laboratories around the country. The other factor is our focus on the highest risk individuals to ensure that we can return tests to them as quickly as possible. These are folks that are in the hospital or the healthcare workers who may have been exposed and who are otherwise treating people who are in the hospital. We recognize, however, that this backlog number is too high and unacceptable, and here's what we're doing about it. One is that we are working to acquire an additional piece of equipment that will help with the extraction process that is a part of the overall testing process for COVID-19. We hope that that new and different piece of equipment will have a steadier supply of reagents, these chemicals that are in short supply. The other thing that we are doing is working with one of the commercial laboratories that I mentioned to have them help us get results back as quickly as possible. So again, the number that we've got is too high, and we recognize that, and we are working diligently to operationalize a plan to bring that number down as quickly as we can. Finally, the number of negative tests in the state stands at 3,014 as of this morning. Before I turn things over to Governor Mills, I'd also like to provide an update on our continuing distributions of protective equipment. Again, this is protective equipment such as masks, face shields, gowns, and gloves that is used and worn by healthcare providers and first responders across the state. As with the laboratory chemicals, there is also a shortage of this protective equipment. And so our task right now is to distribute this scarce resource in a fair and equitable manner. Yesterday, Maine CDC distributed roughly 22,000 pieces of protective equipment to healthcare providers and healthcare entities across the state. Just to provide a flavor for who received those vital, life-saving pieces of protective equipment. Among the recipients were 68 local fire-based EMS and rescue services, 22 local law enforcement agencies, such as local police departments and county sheriffs, 16 municipal-based emergency medical services, 9 regional hospitals, multiple agencies within tribal nations, and certain state facilities, such as our veterans' homes. Today, Maine CDC is continuing its distribution of this protective equipment and shipping out roughly 16,000 pieces of protective equipment on top of the distributions that were made yesterday. And finally, I can also report that this morning, Maine CDC received its second shipment of PPE from the Federal Strategic National Stockpile, which arrived at CDC's warehouse. I've previously provided the numbers of what's in that shipment. I'm happy to do that again if needed. Finally, I'll just provide a quick update with respect to availability of scarce medical resources. As of this morning, there are 77 total intensive care unit beds available, 248 ventilators available, and approximately 84 respiratory technicians who stand ready to assist. As I close, I'd just like to remind everyone once again that these are difficult times for many people. And we ask that everyone recognize that different people grapple with the stress of scary and uncertain situations in different ways. If you are having difficulties, please reach out. 211 is available. And if you are in crisis, please call the Maine Crisis Hotline at 1-888-568-1112. Please remember that you are not alone, and that people can be there for you, even if they are not there with you. Thank you very much. I'd like to turn things over to Governor Mills.
Thank you, Dr. Shaw. Thank you for the incredible work you and your office are doing in recent weeks, especially carrying on the vital work of protecting our public health here in Maine. And thank you, Regan, for helping us communicate to the broadest audience possible. I know I speak for countless Maine people when I say thank you for keeping us up to speed on the changing situation with clear information and guidance on how we can keep ourselves and one another healthy. The challenge of mitigating the spread of COVID-19 is one we share with the rest of the world. The solutions we pursue must not be done simply because somebody else did it in another state or another country. The solutions must be right for Maine people and for the health of our people. I've been very grateful for the ways Maine people have met this shared challenge with unique solutions and offers of generous donations in recent weeks. Just this morning, ND Paper, based in Old Town and Rumford, donated 1,000 N95 masks to the state of Maine for our distribution. People have been emailing and calling every day. Everybody with a sewing machine wants to sew masks, and we vet those requests, those generous requests, through Maine CDC and DECD. Right now, LL Bean workers who are not employed in public-facing retail are helping the Good Shepherd Food Bank package food supplies to places all across the state. Yesterday, I spoke with all the tribal chiefs in the four tribal entities in Maine and sought their needs, and we're addressing them. I spoke for the fourth time, I think. I had a conference call yesterday with the vice president. 3 of those calls have been with the president as well, where all 50 governors are on the line and stressing what the states need now, including the shipments of PPEs that we are getting now and that will continue. We are stressing the financial needs of the state as well to the federal government, and constantly talking with and emailing the congressional delegation, all 4 of whom have been extraordinarily helpful. Right now, Maine Seacoast Mission and other organizations have established drive-through pantries. The Humane Cooperative Extension has created a portal to connect farms with available food to consumers who might access it. The Maine Children's Center in Augusta has partnered with Maine General Hospital to provide child care to healthcare workers. People are stepping up to the plate. Maine Craft Distilling is making and distributing its own hand sanitizer. Who'd have thunk that distilleries could turn into such uses? But they're stepping up to the plate. I'm proud of Maine people. And for those who are interested in donating or offering services or supplies, the state is creating a portal to help you determine the best place to direct those efforts, and we hope to have it live in the next couple of days. It'll be called Helpers, helpers.gov or something of that sort. Maine people are what sets us apart. Just as we're not like any other state or country or city, and no town or business or family in Maine is the same either. So I have avoided mandating actions statewide and have instead issued strong recommendations for Maine people to prepare for and respond to this virus. And I've wanted to give Maine people a chance to make plans before upending their lives. I've strongly recommended all non-essential public-facing businesses like gyms, hair salons, theaters, casinos, shopping malls, and the like to close their doors to the public to minimize opportunities for social gatherings and groups of more than 10. And that was not an easy recommendation for me to make last week. I know it was not an easy recommendation for many people to comply with. Still, most people did. Today, I'm implementing another measure to mitigate the spread of the virus, to protect the health of our loved ones and fellow citizens, and to safeguard our capacity, the capacity of our healthcare system. As Dr. Shah has explained numerous times, we are trying to prevent an overload on our hospitals, on our healthcare providers at all levels. That is what's come in other states and other countries. We want to try to avoid it here. So this is a measure that several other states, or similar to what several other states have taken. Effective tomorrow, March 25th at 12:01 a.m. and for a period of 14 days through April 8th, 12 a.m., I am mandating that all non-essential business and operations of any sort in Maine close their physical locations that are public-facing, meaning those that allow customer, vendor, or other in-person contact. This order also closes non-essential businesses, sites that require more than 10 workers to convene in a space where physical distancing is not practical. This mandates what I had previously recommended for non-essential businesses across the state. This does not include entities that provide essential services that would include food processing, agriculture, industrial manufacturing, trash collection, groceries, household goods, home repair, auto repair, pharmacies, medical facilities, of course, childcare, insurance, banks, gas stations, other such commercial entities. Non-essential businesses, and we're relying in part on the Homeland Security definition of essential services, but non-essential businesses and operations can continue those activities that do not allow customer, vendor, or other visitor in-person contact, or that do not require 10 or more workers to gather in a space where physical distancing is not possible. And they may act to facilitate the maximum number of employees working remotely. So we're not shutting down businesses, we're shutting down public-facing physical plants. For example, an insurance company or a bookstore could close to the public, but still operate, take orders, process claims, deliver goods, and stay open in that sense. State government remains open, but our offices have significantly moved to telework and dispatching from home. They have limited public engagement, and they have required physical distancing within all office buildings. The Department of Administrative and Financial Services estimates that 70% of state government employees are now working remotely. And I want to take this moment to express my deep appreciation to the state employees who are adapting in this new environment, to working still to ensure that we still provide critical services to Maine people. I ask all businesses and enterprises, nonprofits, other entities not listed in my executive order, if you believe that it is essential to do what you do, or that you are an entity that provides essential services, you may request such a designation. And you can request that at maine.gov/essential service. I had also previously recommended that all essential businesses like grocery and convenience stores, banks and gas stations, pharmacies, laundromats, that they implement physical distancing measures to keep their workers and their customers safe. I've talked with the Maine Retail Association. I've spoken with the managers and regional managers of many large stores. And in response to those conversations, I am recommending that they do a lot better. We must do better. I'm strongly recommending that all such businesses who may sell groceries in one part of the store or pharmacy products in one part of the store, that they immediately employ strict strategies to reduce the congestion in the stores. What I'm recommending is for stores with physical retail space of more than 5,000 square feet, limit your customers to no more than 100 people at a time. Enhance curbside pickup and delivery services. Stagger your hours for employees and for shoppers of a certain age, as some groceries are doing now. Close your fitting rooms. This is not the time to shop for clothes. Caution customers against handling merchandise that they're not purchasing. Mark 6-foot measurements by the cashier stations. And remind customers to remain 6 feet apart at all times in and outside the store. Stagger break times for employees and require frequent hand washing. Sanitizing high-touch areas such as shopping carts frequently. I want to be clear. Essential businesses and entities that people count on for basic necessities, like groceries, corner stores, pharmacies, etc., daycares, pet food stores, banks may still stay open, and you, Maine people, will have access to food for your family, your pets, gas for your car, medical care, and medication. But do not go to the store because it feels like a good thing to do. Go to the store only when you really need something, and first call ahead and ask for curbside delivery. Stay away from other people. Just because a store is open doesn't mean it's safe for you to go there. And it doesn't mean you should take your whole family there. It means common sense practices, like make a list and send one person to the store after calling for curbside delivery to get only those things you need. It's not the time for discretionary shopping. It's the time for only essential activities, for essential goods, services, and products. I recognize these decisions create significant difficulties for people and for businesses and entities across our state. And this applies not only to for-profit businesses, but for nonprofits, entities of all sorts. I know people in my community enjoy a Beano game on the weekends at the Elks Club or the American Legion suppers on Saturday night. We can't do those anymore, not for now. The next 15 days are critical at flattening that curve so that Maine stays ahead of this thing as much as humanly possible. We're confronting an unprecedented challenge. Some people have asked about non-Maine people, non-residents coming to our state. I know that, at least anecdotally, this is an action. Know that I cannot just close the borders of our state. Constitutionally, I'm not entitled to do that. The traffic patterns from the turnpike do not reveal a huge influx of traffic. But for those people who may be subject to orders in other states that require them to stay in place, and if they believe they can escape that by coming here, if they believe they can escape the virus by coming here, they are wrong. They cannot escape it because it is here. It is everywhere. And regardless of the state of residence, your state of origin, our laws and orders and guidances apply here to everybody, to visitors and residents alike. You should not be traveling to Maine to take an early vacation. You should not be participating in any gatherings of more than 10, and for that matter, Fewer than 10, it can be very difficult too, space-wise. Don't get together closely with other people. I urge you in the strongest possible terms to engage in physical distancing at all times in order to protect your health and that of your families, loved ones, and fellow citizens. To the people of Maine, I am consulting with the Maine CDC, with clinicians and health systems leaders, with other states, with our own coronavirus response team to examine all options every day, including the various actions taken by other states. These discussions are ongoing, and we focus on three different things. Will an action effectively protect the health and safety of Maine people? Secondly, how will it impact the day-to-day lives of Maine people? And are those impacts outweighed by the benefits? 3, are the long-term consequences of such an idea outweighed by the short-term gain? How do we balance the need to keep people apart with the needs of someone who needs dialysis or cancer screening and having to delay some of those things or forego care, and the potential for people no longer donating blood amid a severe blood shortage? Something I plan to do as soon as possible. These are the types of considerations that weigh on my mind as we consider the possibility of even more restrictive orders. I hope we can avoid taking further steps, but it depends on our collective actions. It depends on not only our most essential businesses staying open and those who do stay open implementing physical distancing measures. It depends on Maine people staying away from groups and standing 6 feet apart from others in any circumstance, indoors or outdoors. I was asked this morning about pickup basketball games and baseball and sporting events. And those do engage in physical contact, and you got to avoid that. I'm sorry, I know it's fun, and it's what kids enjoy and people of all ages enjoy, but we've got to prevent that for now. Depends on whether we choose to stay apart today so that we can come back together tomorrow. I urge all people to take seriously the threat of this virus and to practice physical distancing. I also continue to urge all Maine residents who are considered at higher risk, such as older Mainers and those with underlying health conditions, to limit social interactions as much as possible. But staying at home whenever possible, staying apart from one another, we may be able to avoid taking other more drastic actions. God bless you and keep you and yours, and God bless the state of Maine. Happy to take questions, and I think Dr. Shah has a lineup.
Great. So we'll take some questions in here. There are 3 folks on the phone that we'll turn to in a bit, but we'll start with questions here in the room. Steve?
Quick question on the testing and the equipment you're considering buying. My understanding is, can you tell me if that's, is it Quigen? Is that the reagent you would be using for the additional equipment if you did purchase it? Or is it different?
So Steve's question is, if we purchase new equipment, what reagent or chemical will it use? This might... One of the things that we're concerned about is that if we purchase this equipment, other states may do so as well. And we are concerned about a high demand on that. And so for the time being, I'm not going to note the brand of the piece of equipment that we are considering purchasing. The piece that we currently have, the equipment itself is made by the manufacturer Quigen. And that's the one we have right now. The reagent, the chemical that is in short supply, is manufactured by Roche, as it turns out. And again, for reasons of wanting to just make sure we manage demand, the machine that we're thinking about purchasing is made by a separate manufacturer. It is fully FDA approved, so on and so forth. So not trying to be opaque, but we're concerned, and we're trying to manage the supply chain so we don't find ourselves in the same situation a week or 2 from now. So, Don, and then we'll go to the phone.
To the governor, 2 unrelated questions. One simple: are you going to have the Maine income tax deadline shift to the federal change that was just announced?
Good question. Oh, go ahead.
And the other question is about what you just announced. Did you consider
We're considering all kinds of steps every hour on the hour, frankly. It's some states have looked at what people can't do. I'm looking at what they can do and how to minimize physical contact within the parameters of what they can do. Maine is different from other states. We're the most dispersed population of any state in the country. Sometimes that's bad, sometimes it's good. We've talked about state parks, talked about the beaches. We've talked about what local entities and municipalities are doing in their own locales, and their needs are sometimes different from one locale to another. Likewise, the needs of one state are different from those of other states. Connecticut, Illinois, New York, Massachusetts, Pennsylvania have all taken, California, for instance, and have taken different actions in response to different urgencies and different densities of population and different kinds of gatherings that they tend to attract. So we're looking at all different options at all times, but this is the action I choose to take today to address what I perceive as what people are doing that they might not want to do in coming days and weeks. In terms of the income tax filing deadline, I'm disappointed. I think most state governors are not particularly happy with the federal government's action. We are conferring among ourselves and with our own treasuries and revenue services about what we can do, how we can accommodate the federal government's extension without sacrificing state finances overly. So we're looking at that. Have not made a decision about the April 15 deadline, which is now in effect in Maine.
Great. Could we go to Nick Zambides from the BDN on the phone?
Is this a speaker? Nick?
Nick, are you there? Okay, we'll try to come back. We'll try Kendra Caruso from the Republican Journal. Okay, we'll go back to the room. Yep.
Governor Mills talked a little bit about people coming in from other states, and I wanted to talk a little bit about the airports and what sort of screening protocols are happening.
Airports.
We're hearing from people about coming in off the plane.
Can't hear you very well. I'm sorry.
So one of the things we heard is that the plane landed at Portland, 6 people got off with symptoms and were immediately went to an urgent care clinic, and that was concerning. And I didn't know if these are the kinds of things you were hearing, and whether or not there needs to be any sort of precautions for people coming in through the air.
Well, an airplane, by definition, is a fairly crowded situation, and I would discourage that. I'm not familiar with the particular actions you've just described, but happy to look into it, take follow-up action.
Great.
I'm sorry, I can't hear very.
What would it take for you to order a shelter in place?
Well, we're not using that term, first of all. Stay-in-place orders, we're seeing how they work in other states where there is much more congestion to begin with. Look, there are public health risks to people staying in place as well as public health risks to people not staying in place. We're weighing those, and it's a balancing act day to day. Want to see what people are doing, getting the word from the ground, seeing what people are doing and observing and hearing. If there are locales in particular that don't feel that they can be confined or shouldn't be confined and are taking advantage of the situation, we'll address that accordingly. But right now, I think I want people to enjoy life as much as possible. Within the extraordinary circumstances that we're dealing with in this extraordinary environment. And we've heard a lot of stories from other states in particular about crowded beaches in Miami and Fort Lauderdale and California, and people thinking that they're not immune because either they haven't heard the statistics or they're not understanding that the test results are just the tip of the iceberg, as has just been described. We have people who are ill from this virus of all ages, all age groups. We want everybody to be cautious and courageous at the same time. Yesterday I heard from a friend of mine whose granddaughter died yesterday in another state from the COVID-19 virus. She was 25 years old, a beautiful young woman, otherwise healthy. This can happen to anyone, anywhere. So we're asking the Maine people to continue to comply with our guidelines and our orders and mandates to protect all of us and to protect our healthcare system from being overburdened.
Would it be a matter of maybe if people aren't heeding that, those wishes strong enough? Would it be possibly like a matter of like cases getting to a certain threshold? I mean, obviously every case is serious. Are those the kind of things that you're considering?
Well, I'm not going to speculate on what people might do because I expect them to do the right thing. They are, for the most part, right now, doing the right thing. We're reinforcing what we've said before. Dr. Shah is reinforcing it every day in these rooms, in this audience. People are listening, I believe, but I just want to make sure. Oh, somebody's on the phone. We just want to make sure, get the word out as much as humanly possible. What?
To the person heavy breathing on the phone, your line is open.
You said something about Paula Page.
Yeah, Beatty's calling in from the Bangor Daily News. Sorry about that. Quick question is, if people are snowbirds or out of state, would you recommend they stay where they are, Mainers, or come back home? How do you think they should handle it?
Well, I guess it depends on how they're traveling in part, but we recommend, I think most states are recommending that people stay where they are, not travel, keep your activities as minimal as possible. It may seem like a secure, go ahead.
In other words, if I'm a snowbirder in Florida, I should stay where I am. I shouldn't come home early. I shouldn't, should you stay beyond, or what's the general idea about traveling if you're normally away from here this time of year? Just keep doing what you do normally, or try to get home. What do you think of that?
It's a good question. I'm sure a lot of people, say 6 months and a day, just about up, a lot of people are considering the ramifications of travel or not travel. Look, if you're safe where you are, stay where you are. Travel inevitably means contact with other people. You can't drive from Florida to Maine without stopping at a lot of rest stops. I know I couldn't. Or flying in a congested airplane. Or, Amtrak's not really working right now. So it inevitably means making contact, which we're trying to have people avoid.
Okay. Well, thank you very much for taking this call.
Thank you, Nick.
Dr. Shaw, I have a question for you. The personal protective equipment with the infusion of stuff today and the shipment from the federal government, how would you categorize where things are at in Maine hospitals and follow up on those handmade masks? I've seen a lot of folks wanting to make that. How effective are those? And I know the governor mentioned the site coming forward on connecting people to the right resources, but what should they do in the interim before that?
So the first question is around assessing the status of protective equipment across the state, and where are we? And protective equipment of this sort is used not just by hospitals, but as you noted, or as you could note from the figures that I provided, the bulk of the distributions that we made were to local level fire, EMS rescue, local level police departments, things of that sort. That's really who's getting the PPE right now. It's your neighbors, who we are starting our distributions to. That being said, we have, and Governor Mills has underscored the need for the federal government to increase the distribution of protective equipment from the federal national stockpile. Although what we've received is a good start, it's not where we need to be, and so we continue to urge the federal government to release additional stockpiles of protective equipment.
My understanding is a lot of the equipment right now has been focused on 12 hot spots across the country. We are not considered yet a hot spot, but that's where the equipment is being directed primarily. But we are receiving supplies now.
Governor Mills,
Hi.
as you're probably aware, the president has been making some comments lately about getting back to work and going to business. If there were ever a scenario where he makes that order, basically people go about their business as usual, and that conflicts with the order you're just given, what do you do?
See, that's really speculative. Whatever he says off the cuff is not does not rise to the level of an order or a forecast or a prediction. of substantive value.
Governor, you know the ongoing issue about that ironworks.
Yes.
Question of essential. Are the Speaker of the House and President of the Senate sending another letter to the congressional delegation, trying to push them harder to take action and push the Navy to allow the IW to close? Are you going to sign on to that letter or that?
You know, Don, the congressional delegation has already written such a letter a week or so ago. They've gotten a response from the Department of Defense, which is not entirely satisfactory, minimizing that, not satisfactory at all. And I have talked with the Bath Iron Works management about precautions they're taking to prevent gatherings of people in close proximity, to prevent the typical congregation of workers coming and going at the gates during shift changes, to prevent break rooms being crowded, things of that sort, and providing sanitizing, hand sanitizers and hand washing stations at at regular intervals. Those kinds of things they're implementing. But I've also communicated with the Vice President following yesterday's call, because this is an issue that doesn't affect only Maine. It affects 10 or so other states. Other places where General Dynamics has business operations, places where their competitor, primary competitor Ingalls, has operations. Portsmouth Naval Shipyard, they're working in submarines, rehabbing submarines, pretty tight quarters. So I've asked the Vice President to ask the Department of Defense to look into all those operations and to modify the contracts with those entities, those private entities, to modify the deadlines and due dates of those contracts so that those entities, employing as many as like 6,800 or more in other states, so that they can allow some leave for their employees. And I'm asking the federal government to supply some funding to support leave that may be necessary to protect the health and safety of workers in those industrial complexes.
Going back to personal protective equipment for
Yep.
The state, Maine had purchased millions of dollars of personal protective equipment and breathing assistance devices to prepare specifically for mass casualty events and infectious disease events with federal money. Where is that equipment? Do you guys have an inventory of them? And has All Clear Emergency Management, who you guys began contracting with in 2019?
What's the last part? I'm sorry.
Has All Clear Emergency Management, who you started contracting with in 2019, given you any advice on where that equipment is and how to distribute it? And then also, do you stand by Governor Paul LePage's decision to outsource that contract that was with the regional resource centers for 2 decades and now is with an out-of-state company?
I'm sorry, I can't answer the question about the contract. The rest of your question is really addressed to MEMA, who is responsible for inventorying all of our available equipment, and I believe they have done that. Pretty confident they've been doing that in close coordination with Maine CDC and with the federal government, with FEMA.
And Samantha, your question pertains to activities that were undertaken 2 years ago. Right now, our focus within Maine CDC and MEMA is getting the stocks and supplies of protective equipment that we have out to first responders and healthcare providers in the field. We'll get you answers to your questions, but right now, our focus is on keeping Maine people safe and the healthcare providers who take care of them safe.
But you are
Thank you.
waiting on federal supplies to arrive, so what happened to all the existing stocks?
Again, your question pertains to activities almost 2 years ago. And so right now, our focus is taking the supplies that we've got and putting them out there for healthcare providers and frontline workers. We'll make sure we get you answers to your questions.
Dr. Shaw, President Trump has talked about a cure for COVID-19. Can you talk about that? I've been pushing something to
He's on it. He's on everything. He's got tomorrow, the cure.
A cure is an interesting word. So in medicine, there are different degrees of treatment that we look for. And with something like a virus, what we look to do is to tamp down the amount of virus that's in the body so it doesn't cause the signs and symptoms of disease. There are a number of different clinical trials that are underway looking at different therapies that are out there. There was a report last week that unfortunately showed that one of the promising therapies, a cocktail that's used for HIV, the early report suggested it wasn't as efficacious. But there are 2 other drugs that are still being studied. One is a drug that's called remdesivir that's also a well-known drug that's used in viral disease, and there are a number of trials, many of which are supported by the U.S. government, that are underway. The president also referenced the potential use of another drug that's been around for a while called chloroquine, which is used in the treatment of malaria. As with a lot of these questions, they're great scientific questions, and as with most scientific inquiries, we won't really have a good sense until the data are in. But this is what the scientific community does, and that's what they're doing right now.
Dr. Shaw, we've seen over the past 2 weeks when a case is found positive here in Maine, but they're a resident of a different state that gets classified back to that state. Are those people still able to live, say, like in Knox County? And people want to know, like, are there people still living in their communities and they're classified in another state and the number might be lower, but those people are still there?
Good. So the question is, for individuals who are residents, full-time residents of other states, but who might be in Maine temporarily, who are diagnosed with COVID-19, how do we handle those folks? And the Maine CDC does what every other health department in the country does. We follow a national compact or protocol where cases are recorded for bookkeeping purposes in the state of permanent residence of the individual who is infected. Now, that's really a bookkeeping measure. The public health measures are still undertaken by the relevant state health department for where they currently are. But the question or the concern that underlies this question is the idea that, gosh, if I only knew that someone were in my county, I might do something different today. I might take steps differently if only we would report on these other folks. And that supposition, that assumption is not true. Everyone should start behaving as if the virus were in their county, were in their city, and in their town. Even though your city, county, or town might not be on our board, you should think and go about your lives as if it were. Again, the absence of evidence in this case is not evidence of absence. And
The state has talked about trying to get more ventilators. Do you think that there are enough hospital staff in the state who can operate them, or do more need to be trained? And does the state have enough units where they can be operating on that?
Good. So Caitlin's question is around ventilators and how we think about the need for ventilators and how we would operationalize that. And when you think about ventilators, you need three things. You need the ventilator itself. You need someone who can operate and optimize the settings on the ventilator. And then you need a place for that ill patient. So we're working on all three. The request that we've made from the federal government is for 300 additional ventilators on top of the 300 or so that we have. The other thing that we need are people to operate those. Right now, because of Governor Mills's recommendation to cancel or postpone all non-elective surgical procedures, we are working with the others that would have been involved with that, namely anesthesiologists, who are not in the OR right now with working on surgical procedures, but rather could be mobilized in quick fashion to help out if they were needed. And then the third thing is space for the ill people who require the ventilator. And so we're working with the healthcare systems, one, to assess the current number of beds that we have, but also look for ways in which beds that are currently not categorized as intensive care units could be adjusted to accommodate a patient with a ventilator. So we're looking at it from all sides. So, really, I think the way I think about this is that the ventilator itself is necessary, but not sufficient. We also need personnel as well as space, and our planning process is accommodating all of those.
I will also add that yesterday the Vice President asked all governors to take inventory of those ventilators that are not the kind that we're calling on right now, but they may be in existence in clinics and outpatient facilities which are not now being used because of the restrictions on elective surgeries and appointments and procedures. And there are certain kind of ventilators that can be adapted because the FDA just approved a change in the vent that we can do with short-term training to make those ventilators available in hospitals for seriously ill patients.
Governor Mills, are you anticipating a point at which
Sorry.
you diverge from the federal government at all? And what I mean by that is, if the White House says something like we can open up the economy by mid-April, do we do that in May? What happens there?
That's similar to a previous question. I'm not going to speculate on what happens in May. we're taking this 1 hour at a time, 1 day at a time, holding our breath and being as patient and cautious as we can, and asking the Maine people to do the same.
Dr. Shaw, can you give us an update on Ocean View in Falmouth, whether any of the cases that were reported today include any folks from that facility?
So Steve's question is about an update for the Ocean View community in Falmouth, and whether in particular any of the cases that we've reported today are among residents of Ocean View, or community members of Ocean View. Based on our investigation that's just started this morning, none of these new individuals is a resident of the Ocean View community. More generally, we continue to work with our colleagues at Ocean View. I think, as I may have mentioned yesterday, Steve, because of our concern for the well-being of Ocean View residents, I've asked my senior deputy to have a standing call with Ocean View on a daily basis to make sure that every single concern they've got, whether it's infection control, clinical management, protective equipment, is immediately routed to a senior member of my team for immediate distribution. Just earlier this afternoon, our colleagues there had a quick question they needed an answer to regarding infection control practices and application of the CDC guidance. One of our medical epidemiologists was able to get on the phone with them very quickly. So we are maintaining a very open line of communication with them, given our concern for the well-being of those residents.
I have a question for Governor Mills about evictions. I know that other states have taken slightly more aggressive actions, but there are still writs orders that the courts put in place before this all hit, and they're still being enforced in some communities, including Portland. And I wondered if the state can do anything else to prevent that from happening.
I'm sorry, mixed orders? How do you mean?
No, they're writs.
Oh, writs. Writs and orders. Oh, okay.
But they're still being enforced, we're hearing, in some communities. And I wonder if there's something
in the state of Maine?
Yeah.
According to Chief Justice Softly's order from a week and a half ago, I did not see that FED measures were part of the emergency operations that they were going to be engaging in with the public. But I mean, I could be wrong. I'm talking with the Landlords Association later today. We know that, among other things, the federal government has ordered that what used to be called Fannie Mae, Freddie Mac, will issue orders of forbearance on mortgages of landlords, property owners, conditioned on them forgiving rent payments related to the COVID-19 virus. I'm looking at evictions and thinking about them in different terms. Not all evictions are the same. For evictions related to non-payment of rent that is related to the COVID-19 virus, I will actively discourage evictions from going forward on those cases. There may be a number of other kinds of evictions for other reasons where people are trying to save their property. But sorry.
Governor's got time for one last question.
How are you keeping the legislature abreast of things? Like, obviously, you know they're not in right now, but I imagine many of them have questions about
Certainly.
finances, like what your plans are. Can you talk a little bit about that?
I spoke this morning for 45 minutes with the Senate President and the Speaker of the House. We've fielded a number of inquiries and observations from, I think, all 186 legislators and leaders of both parties, and we're fielding those inquiries. And, you know, they have their eyes and ears on the ground. They're telling us some of the things that they're hearing and seeing, which are valuable for us to know in order to respond to protect the public health. It's all good information, and they have their job to do, keeping their constituents informed, and we're trying to help them do that. Does that answer your question?
Caitlin, I'll also add on top of that, I conduct a weekly briefing for legislators on the COVID-19 situation particularly.
Can I clarify one thing on essential construction? We're about to start construction.
Yes.
Are they included under the essential heading?
They are. I believe they are specifically, yes. I can take a couple.
Governor Mills, have you been tested for coronavirus?
Why would I be? I don't have any symptoms or, no. I haven't knowingly come into contact with anybody who's affected, so no.
Governor, as you were giving your remarks, the city of Portland announced that it was going to institute a 5-day, not shelter in place, but stay at home order. Do you think that's the right move for the city? I know that you're saying that I think you basically said that localities can make these decisions on their own, and you're okay with that. But
You know, they're on the ground seeing what's happening in their city, which is as you know, the largest city in the state of Maine. They're seeing other problems and issues that we may not be seeing elsewhere, and they're entitled to take what precautions they feel necessary and appropriate to protect the people. Well, that's like 4 for you. Sorry, no.
Sorry, but
Go ahead.